Hello everyone, welcome to sqadia.com. Today we are going to talk about the practical aspects of surgery. Like you're performing a surgical procedure and now you have to perform an anastomosis, or you have to put down a drain, or you have to use the diathermy probe. So we'll look into what an anastomosis is, what a drain is and how it functions, and what is the diathermy probe. Before getting into the details of it, I'd like to elaborate these terms in a little detail. Anastomosis is something when you form a junction between two tubes. Usually, two hollow tubes are connected with each other, and this allows the passage of fluid, the passage of whatever material is within that tube. This is known as an anastomosis. So, in simple words, an anastomosis is junction of two hollow tubes. So, to perform an anastomosis, this is mostly performed in bowel surgeries, and when you have to perform an anastomosis, it should be airtight, it should be watertight. Airtight so that no gases might leave the colon, and watertight so that no fluids, no liquid materials might leave the colon. So your anastomosis has to be perfect. The junction you have made has to be perfect. What is the need of making this junction? Now, the need of making this junction depends upon what type of pathology you're dealing with. For example, in a person with corrosive intake, a large amount of the bowel has been damaged. So you have to remove the damaged bowel and you have to connect whatever remnants of the bowel are there. So when you connect these remnants of the bowel, you create a junction, and this junction is called the anastomosis. So now we are clear on anastomosis. Moving on to the drains. As the name implies, drains are actually the draining tubes, the draining structures. These are placed within the wound sometimes. Now the practice of placing the drain within the wound is obsolete. You don't place the drain within the wound now. You place the drain separately through a separate tube. You place the drain in your surgical field so that if there is any pus, if there is any leakage, if there is any fluid, it might be drained through that drainage tube into your drainage compartment. With that, you get an idea of how the surgery went and how well your anastomosis or your junction or your fusion was, and how airtight and watertight your anastomosis actually is. For some surgeries, drains are necessary. You need to place a drain there. For example, in thyroidectomies, placing a drain is very important because it's a closed space and can choke your patient. If a hematoma develops in that area, it can choke your patient. So, in order to prevent this, you place a drain and you closely monitor your patient. However, placing a drain in abdominal surgeries is somewhat questionable now. Now, diathermy. Diathermy is actually a probe that is used for charring and cutting. Whenever you'll go into the operating room, you might have already seen they use a pen-like probe or an instrument that is used to cut the tissues. The principle of diathermy is that electric current passes through the tissues and causes charring of the tissues. So diathermy is a probe that is used to cut and divide the tissues. Now let's see how the lecture is divided this time. We have 4 sections. In the first section, we'll be talking about the anastomosis. We'll see what are the various types of anastomosis. I've explained the anastomosis in itself. Now we'll see what the types are. In the second section, we'll talk about the drains. Again, we'll talk about the various types of drains and how to place them and what are their prerequisites and what are their advantages do we get from putting a drain. In the third section, we'll talk about the principles of diathermy. Now, this is one of the neglected parts of surgical field. Most of the surgeons do not pay a lot of attention on the principles of diathermy. It is very important so that you might prevent your patient from having an electrical episode during the diathermy. So it's very important you understand these principles. And finally, we'll talk about advanced energy devices. We'll see what these are, what are their functions, and how they're better from the devices we already have. I hope you're excited about today's lecture. For further such lectures, keep watching sqadia.com.